Hi everybody, welcome to my show, Paging Dr. Gupta. My name is Gupta. I'm a student doctor in training. I'll be graduating in May, so I'll be a full doctor here soon. Today we have Dr. Sam and Dr. Dar from AFD, America's Family Doctors. And so today's segment will be about supplements, diet, and exercise. So my question to you guys today is very important. So the cost of healthcare is just soaring through the roof, and just medical bills are a huge, cost of healthcare these days. So as far as what can we do, the general population to avoid, getting sick, or just kind of preventive care wise, what can we do?
That's a great question. I'll say for me personally, I have essentially major medical insurance. I have a $12,000 deductible.
Okay.
Could I afford more expensive health insurance that covers more things? I could, but I may have to skip, meals, vacations, be late on, house payments. Health insurance has gotten very expensive. And so now that I have, and I've had it for many years, major medical, $12,000 for my family, if we're really sick or something's an emergency, we will go. And I'm happy that, say if we end up with something catastrophic and it's a $200,000 bill, I'm happy that all I would have to come up with is $12,000. So in that respect, it's good. But do I really want to get sick? Do I really want to get diabetes,
no,
hypertension, take any medicine whatsoever? No. So we try whatever we can to stay as safe and healthy as possible.
Okay. And are there certain things that we can take, to prevent getting sick and just to stay healthy overall, like supplements that you would recommend, Dr. Dar?
Yeah, I do recommend. Well, I think the biggest thing is to eat healthy. Make sure that you're eating your vegetables and fruits. And as far as the supplements, I do highly recommend taking vitamin D and a multivitamin and getting your levels checked and see if you're low. Then definitely take the vitamin that you're low in.
Okay.
And in general, eating healthy and staying active, helps a lot.
Okay. And Dr. Sam, so as far as, vitamin D, if somebody was to ask, okay, I should be taking vitamin D, but there's so many different supplements out there, how do you know how much you take?
That's a great question. Most people will need vitamin D3 between 2,000 and 5,000 units a day. You don't want to undertreat, you don't want to overtreat. So without having your levels checked before and after, or once you're on a stable dose, you won't know. So,
okay.
I personally have to take 5,000 units a day. And yourself?
I'm also the same.
5,000.
Being darker skinned.
Yeah,
I take
5,000 units a day. Exactly.
Okay.
But I know my parents both take only 2,000 units a day,
okay.
and that gets their levels up to normal.
Okay. And how often do you recommend, patients check their labs, as far as supplements to make sure that they're, in the right range?
I check them, whenever the patients come for their routine physical, and then after they've started replacing it, we can check anytime between 3 to 6 months.
Okay. Okay, and what other supplements besides vitamin D? I know you said a multivitamin. Anything else that you would recommend?
Yeah, and I'll tell you the ones I take, but one quick little rule of thumb for vitamin D is for every 2,000 units you take, generally it bumps up your levels by about 10 points.
Oh wow, that's really good to know.
Yeah,
okay.
so if my levels are really low and I take 5,000 units, then chances are I should go up about 25 points.
Okay.
So and then I guess there will be people in the summer who get a lot more sun. They may go down to 2,000 during the summer.
Okay.
For me personally, I don't really get too much more sun in the summer because it's like 100 degrees outside.
Yeah, that's true.
So it's hard to even go outside sometimes. But as far as the other vitamins I take a multivitamin. As far as a multivitamin goes, there's been a lot of debate, controversy, even for aspirin or fish oil or anything. The one I take is the one we actually carry in our office. It's called Spectraman.
Okay.
And it's officially 2 per day, but I only take 1 per day. So essentially I'm taking half a dose. And do I take it every day? No. I probably end up taking it about 3 or 4 times a week.
Okay.
If that. And for the big thing with the Spectrum Man is it has a lot of B vitamins in there. So I checked my B levels. Prior to being on a vitamin, it was about 300. And with taking the Spectrum Man, just basically half dose every other day, I'm up to 700-800.
Okay.
So I mean, there's no need to overtreat.
Right.
But at the same point in time, I think that's where a lot of the issues come with vitamins. Is if people, for example, vitamin E or A in low doses are good, but in high doses, it's actually
bad.
It's
Yeah.
actually dangerous. So I take a multivitamin. Calcium, never. In fact, we had a bottle of calcium that I threw away. Unless I had osteoporosis or something like that, I would possibly consider it. But that's been shown to calcify vessels.
Okay.
So increase in coronary artery disease. Do I take an aspirin? Actually, I don't.
Okay.
Do I take fish oil? Well, I used to, but now the latest studies show that unless you're in a high enough dose of fish oil, it doesn't really do much.
Okay.
So basically, I take the multivitamin, vitamin D, and I do take biotin here and there.
Okay.
Biotin is just to keep my hair good.
Okay. Yeah, and biotin is really good, so that's something good to keep in mind for your hair. I've been taking 10,000 micrograms of biotin. Has actually helped my hair a lot. So
I take 1,000 units.
you take
when I
1,000.
remember.
Do you take any biotin at all?
I'll start taking.
Okay. Okay. And as far as for athletes, do you suggest them adding anything or subtracting anything as far as supplements?
Yeah, I do recommend them to take carnitine and amino acids and the multivitamins, and again, get their levels checked. It used to be that people would get checked and they would be low in vitamin B12 and folic acid, but we don't see that very often anymore.
Okay.
Because of the awareness, and people are just taking more of those. The most common vitamin deficiency I think we see nowadays is vitamin D deficiency.
So, so you guys can check creatinine levels in the office, and
Well, it's a little bit. There's still a difference between creatinine supplements and creatine levels,
Okay.
and basically for athletes, as Dr. Dar was saying, pointing out, it's essential amino acids,
Okay.
and a lot of it is what their goals are. It does increase performance as far as I play tennis. Generally you can hit the ball harder. If you're weightlifting,
okay.
your levels go up. It's kind of a good source of a precursor for protein almost, so that the other one really good source of protein obviously is meat. But the problem with eating a lot of meat, especially red meat, is it could drive your cholesterol and triglycerides up.
Okay.
So in this case, creatine I think is a great supplement as long as you tolerate well and drink lots of water.
Okay.
Carnitine is another essentially amino acid, which is also good. But I would say if I had to rank them, I would say creatine is number one. Especially, the one I haven't taken in a long time, but the GNC creatine tablets. For me, I'm not a powder person, so those I thought were pretty good. Whey protein is also a phenomenal source of
Okay.
protein. Again, if I at my age, I just play tennis for fun. But if I was really trying to play competitively or doing anything competitively, I would probably be on the whey protein
Okay.
and try to work out more. And it does make a difference.
Okay. And is there ever a chance of having protein in your urine from having too much whey protein? Is there a limit as far as people should watch out for if they take it?
Yeah, I think in general it's 30 grams of protein a day.
Okay.
For a normal adult, and if you're working out and are more in the physical sports and activity, then you can up it to 60 grams.
Okay. Okay.
And if you, just like anything else, if you run too much, jogging is good for you. If you run too much of something bad or good can be bad.
Okay.
And protein, for the most part, in one sitting, our body can't really absorb more than 25 to 30 grams of protein. So if you end up having more than that, it's got to go somewhere.
Right.
And so I think the problem with the supplements is that a lot of people think more is better, and they can end up hurting themselves. However, if you do go to your doctor for your yearly physicals. You don't want to you know, be the winner of a triathlon and be an Ironman and be a good-looking cadaver. You know, there's no point in that.
Yeah.
So you don't want to rob Peter to pay Paul. And so there have been plenty of people who die running marathons who are in great shape. So yeah, it is important to talk to your doctor.
Okay.
And that is something that we like to do because, I mean, the majority of our patients are on some kind of supplement.
Okay. I think that's all the questions I have today for this segment. Do you guys have any comments or anything you'd like to make?
Thank you very much, Paul. It was nice having you.
It was great talking to you, Dr. Sam.
Thank you for having us on your show, Paging Dr. Gupta.
Thank you so much.
Yeah.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Yadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.